All right, so we are going to be doing the ligaments of the shoulder. So we're going to start with what we know. So we're going to start right over here with our sternoclavicular. So we have our manubrium located right there. Our clavicles coming like that. So obviously the ligament connecting them. We have our internal sternoclavicular. If there's an internal sternoclavicular, you know that there's a posterior sternoclavicular. So if I rotate it, you can see the posterior is going to be located back in here, and there are interclavicular ligament on top of the jugular notch, on top of the manubrium, connecting them. So we've already been over those ligaments, so those should be reviewed for you. But now we're going to walk out the clavicle, and we're going to come out here to the shoulder. And really all we're going to be doing here is naming the ligaments for the bones that they articulate with. So we can see the clavicle, and it's S-shaped curved right there. So I'm going to come back, and I'm going to sort of label right here. That's the coracoid process, and there's our acromion process. So if we do have a ligament, which is spanning that gap, we should be able to highlight it. And we should know that there is our Coraco ligament. So you can see it's going from the coracoid process up to the acromion. Then we have this ligament. I'm going to spin a little bit here. It's actually divided into two parts. We have our Coracoclavicular ligament running from the coracoid process up to the clavicle with its two separate heads. So make sure you do your readings to figure out which head is which. I'm not going to give you the benefit of telling you now. And then we have the on top of the shoulder, as I rotate it, you can see we have the clavicle coming in, we have the acromion right there, so that leaves us with our acromioclavicular. This is our acromioclavicular joint. Do not call it the AC joint, call it the acromioclavicular joint. And what this does is it actually forms the roof of that little subacromion tunnel. So you can see this tunnel right here. I'm going to angle myself a little bit. Sorry. Oops. Get back. Clear. I'm going to spin a little bit. There it is. That's a better view of it. So there's that acromion tunnel, subacromion tunnel right here that allows various structures to pass underneath it. So if you do have any sort of osteophytes or bony problems that may actually impinge, we get that subacromial impingement, etc. But that's the tunnel located right there. So there's our ligaments. And then we also have our Granocumeral ligaments. So this is our Coraco ligament coming across. And then if we actually come down here, we actually have a pure ball and socket Granocumeral ligaments holding everything in place. I'm going to dissect that back. And that's going to be our capsule and our Granocumeral ligaments. You can see as I rotate it, it goes around the entire aspect of the glenoid and the humerus, and it really holds it in. Remember, this ball and socket joint is pretty unstable, so you need a pretty deep and extensive ligamentous structure to hold it all in. There's our transverse humeral ligament, because we have to imagine, if we can think, we have the long-headed biceps brachii coming right through underneath it and heading down. So we got to appreciate that transverse humeral ligament is holding that long head in. This is the hardest palpations I have found, is the lesser tubercle and the greater tubercle of the humerus, and then right in between is that bicipital or intertuberal groove. It's the hardest palpation to find because we're talking about very minute differences. But understand this greater tubercle, as I rotate it, all of that red area that you see here, all of this area, that is all greater tubercle. I'm going to continue to rotate it, and you're going to lose the illustration. We can see that whole area is the greater tubercle. It is quite large, especially compared to the lesser tubercle on the medial side. So appreciate the sheer volume and sheer mass of that greater tubercle of the humerus. On top, we have our subdeltoid bursa. So you have to imagine the deltoid muscle on top of that as it comes over the top of your humerus. So that's basically the ligamentous capsular structures of our scapula and of our shoulder. I'm going to flip this over one more time so you get a good posterior view of it. We make sure you go through some of the other videos, but from the posterior side, you can see the superior angle lining up with T2, the inferior angle lining up with T7, the iliac crest lining right up there with L4. So hopefully this will also help you as you are doing your palpations, etc. As you're palpating, make sure you're looking for your lordotic curve, your kyphotic curve, I spelled that wrong, coming back down to your lordotic curve, and then your kyphotic curve as you go through the sacrum. Those curvatures should really help you determine where you are in your palpations when you have your patient prone. So those would be the ligaments, etc., for the shoulder and sort of connecting back into the spine.